Oh, hello again. This is Bob Tauber. We're back to vignettes and giving you examples of vignettes. This is the third example, vignette number 3, in which Louise Jansen and I are going to role play a client so you could get some practice in making differential diagnoses in the area of either mood disorders or in anxiety disorders. This third example is also in mood disorders. It's one of the mood disorders. And I'm going to be the therapist, Bob, and Louise, you're going to be?
Beth.
Beth. Okay, Louise is Beth. So we'll just assume that we're in a session here and Beth has come and seen me. So, okay, here we go. So, Beth, thank you for coming in to see me. I know I heard that, there's some things that have been going on kind of a long time for you. Maybe you could tell me what are some of the things you're concerned about?
Well, everybody keeps telling me that I'm just always so negative and I should really be more positive about things. And I know I am, but, I'm trying. I just, kind of like tired all the time and I don't feel very good about myself, but that everybody thinks I'm just like Eeyore, just like a negative person, and that doesn't feel good either.
So you by negative, do you mean like you say negative things or you think negatively about yourself and others? Just talk a little more about what do you mean by negative.
Yeah, I guess they say I don't see anything good in anybody. Maybe that's true, and I don't see anything good in myself. I'm just tired of being so, like down all the time. And
okay, so let me just get a little bit of the time frame here. So when we say down all the time, just keep telling me like how long this has been going. Has your being down gone? Would you say at least a month?
Oh yeah, more than a month.
Would you say at least 6 months?
Yeah.
Would you say at least a year?
Yeah.
At least 2 years?
A long time.
So you're
at least a couple of years.
So is there any time you could remember when you didn't feel this way?
No, I think it feels like I've been like this forever.
Okay, so nothing even has brought you up temporarily to a more, out of this being down state.
No.
So
I try and go to work and I try to do the best I can, but they always are telling me I'm doing an okay enough job, but I think they just don't like me because they say I'm negative all the time and I'm supposed to present the more positive picture. But it just feels like I can't, and sometimes I can't even concentrate. It just feels like just like I'm murky.
Oh, okay. Well, the thing is has, in fact, for your work then, have you ever had to miss or lost a job because of this state of mind? Or can you still at least function to what's required in your job?
Well, I still can go to work.
Yeah?
I still go.
And have you ever lost a job because of the state of mind?
No. No, I just hang in there.
Right. So it's just kind of this down mood that's lasted for at least a couple years, and you hardly ever are not in that mood, and people see you as you're able to like function with some effort, but you don't lose your job. You haven't lost the job, and have you lost housing or anything like that because of this mood?
No.
Does it affect like personal relationships?
Well, I don't think people like me.
Okay. So it might have some effect on your personal relationships. Okay, well, thanks. I think that learning about what is going on with you is the first step for us to help you look at the issues that are causing it and figuring out what to do about it. So thank you so much for coming in today.
You're welcome.
Thank you. That's number 3.